my name is Rachel, and I'm going to be doing a head, ears, eyes, nose, and throat assessment here for Nursing 383. First, I'm going to start by washing my hands, introducing myself. Hello, my name is Rachel. How are you doing today? Good, good, good. And I would do just a general assessment quick, but I'm not going to demonstrate that here in this video. First, I am going to look at her skin here. Just going to look and make sure there's no lesions or any sort of skin breaks on her that wouldn't be normal. And then I'm going to take a look at her nail beds here. Make sure her cap refill is doing okay and her nails have the correct concave shape on them, and that's all good. Okay, so you can rest your hands on there. Next, I'm going to move to her scalp here. Make sure there's nothing dry, no scaliness, no pain in your head today, ma'am? No. No? Okay. Next, I'm going to feel. Make sure it's all symmetrical. There's nothing protruding out. Her distribution is good. It's all symmetrical, so that's good. Next, I'm going to palpate her facial bones, which I'll do the frontal, the maxillary, and then I'm going to palpate the sinuses, so the frontal sinus and the maxillary sinus, and then I'm going to assess her TMJ. Can you open and close your mouth for me? Awesome, so I can feel that that's good there. No clicking or anything like that. So next I'm going to do her temporal arteries here and make sure that they're okay. Next I'm going to do her eyes. I'm going to make sure her brows are all symmetrical. There's no anything abnormal there. Her eyelashes are all distributed equally. Next I'm going to look at her conjunctiva. This. Okay, and that's pink and red, so that's all good. Next I'm going to move to the nose. I'm going to palpate, make sure there's no tenderness there. Can I have you plug one ear? Breathe. Good, good. Can you do the other one? Good, good. Okay. Next I'm going to move to the ears. I'm going to inspect. Now I would usually use an otoscope for this, but I'm going to make sure there's no tenderness, maybe tug on the ear a little bit, and then I'm going to look at the other one, make sure that they're symmetrical, which they are, so that's good. Next, I'm going to palpate the I'm going to look at the mouth. There we go. So I'm going to look at her lips, make sure they're nice and pink and intact. Can I have you open your mouth? I'm going to look at her teeth and her tongue and her mucosa, make sure it's all moist. Okay, which it is, so that looks good. Okay, can I have you stick your tongue out and say ah for me? Ah. Okay, stick it out and say ah. Awesome. Okay, so her uvula is midline and her tonsils are great. I can't see them, so those I'd probably classify as a +1. Next, I'm going to go to the neck. I'm going to inspect the preauricular nodes, the postauricular nodes, occipital, and I'm going to move to the tonsillary, submaxillary, submantle, anterior clavicular, posterior clavicular, and then I'm going to have her shrug her shoulders just slightly, and I cannot palpate the supraclavicular nodes, so that is good. Next I'm going to look in the trachea and palpate, make sure there's no enlarged thyroid there, so that's good. Looks like that. I'm going to assess her carotid pulses again, and those are good. Alright, so this concludes my head, ears, eyes, nose, and throat assessment.